I am the Director of Education for the Mary Heersink School of Global Health and Social Medicine at McMaster University, and I'm also an Assistant Professor of Global Health with the Division of Education and Innovation in the Department of Medicine at McMaster University in Ontario, Canada. I chose LSHTM for my studies because I was looking for an international education and to study at a world-renowned institution. I had done work in different parts of Latin America and also in Toronto, and I really wanted to have exposure to leading faculty and to research that was on the cutting edge. So when I decided to study and do a graduate degree, I looked at different programs and I found that London School was going to be the right fit for me. After I finished at the London School, I had a chance to work for the London School with an organization called the ACT Consortium. They were looking at how to improve the diagnosis and treatment of malaria worldwide. As part of that work, I was in Uganda for nearly 4 years, working on 2 different studies to improve the way that health workers diagnose and treat malaria at public health centers. My education at LSHTM set the foundation for a meaningful and engaged career in global health. I've used the skills that I learned in research, in policy, in evaluation, not only in the research projects that I have been involved with, but also in the education and the teaching that I do now as a professor. It was the way that professors engaged with us, the way that the program was structured, and the way that we were encouraged to think deeply and think critically that I've brought forward in my skills and in my training and in the work that I do now as a global health professional and a leader in global health. My big dream for global health is that all people worldwide have the chance to access quality healthcare. We really need to move forward in the way that we think about how people access healthcare, where they access it, and the priorities that they have in their lives for achieving and accessing healthcare. It's something that I think we need to move forward with from a comprehensive systems-wide approach. And my dream is that we will get there by working collaboratively, by working in partnership, and by working closely with people on the ground who are affected daily by health systems and by the way that we provide and deliver care. If you are studying at London School or you plan to study at London School, my biggest piece of advice is to get involved. You will get out of the program what you put into it. The connections that you make will serve you a lifetime. So really engage and be prepared to have your life changed.